Hi everyone, and welcome back to the Generalist Low Risk Obstetrics podcast, an extension of the CCFP exam study podcast. I'm Blewett, family medicine resident, and I'm joined by co-hosts Kyla Freeman, a family med R3 focusing in obstetrics, and Patricia Massel, a family physician.
Today we are going to tackle breastfeeding, and specifically how to support moms in establishing good milk supply.
Breastfeeding can be an intimidating topic. Personally, never having breastfed a child, I find trying to teach breastfeeding gives me major imposter syndrome. That's why I researched this podcast, so I could learn more. A lot of this information is based on discussion with practitioners who do breastfeeding medicine, as well as the UBC Latching On e-course and Jane Morton's First Droplets website. A big thank you to Natasha White, who is our content reviewer this week. Natasha is a labor and delivery trained RN and the breastfeeding coach at the clinic I work in. Thanks, Natasha.
Before going on, a friendly reminder that we do not represent any of these organizations and any opinions expressed are solely our own. These episodes are meant for educational purposes only, and our only hope is they pique your interest in obstetrical medicine and get you reading more. You should always defer to your experts' national guidelines, as well as your local settings, policies, and practices.
Another note, in this podcast episode, we will refer mostly to breastfeeding because that is the nomenclature that gets used in lots of books, online articles, resources, and modules. Lots of folks have taken to using the phrase chest feeding because it's a more inclusive saying, and we think that is awesome. So in 30 minutes, you're going to have some catchy sayings, some great pearls in your arsenal. We hope that you'll be more comfortable supporting people with bread and butter breastfeeding or chest feeding.
And remember, for tricky cases, there are lactation consultants and physicians with a special interest in breastfeeding to help you out. Let's get started.
Lesson 1, Giving the Pitch. First off, we're going to talk about giving the breastfeeding pitch. Breastfeeding can be hard to get up and running for some mama-baby dyads. There's going to be sleepless nights, ups and downs, and worries about, is my baby getting enough food? Your patient is going to need a good pitch from you to help stay motivated and push through the tough times to reap the benefits of breastfeeding.
Studies have shown that the comments you make as a family physician can have a profound impact on a patient's breastfeeding success. Having a positive, supportive approach can go a long way.
Various resources we reviewed for this podcast recommend against taking a neutral position when discussing breastfeeding. Neutral support is perceived by patients as negative comments about breastfeeding in general. So don't set up your conversation as a discussion of the pros and cons, which is sort of the approach we'd often take when counseling patients. Instead, when you're starting off talking about breastfeeding, go with a statement like, as your doctor, I want you to know that I support breastfeeding and it's the healthiest choice for mothers and babies. Be confident and positive.
So how much breastfeeding should we be recommending to our mothers?
So 6 months of exclusive breastfeeding is the target that we want to shoot for. From age of 6 months, babies should begin complementary food while continuing to breastfeed for as long as the diet is happy to continue. But even if your mother can't breastfeed exclusively for 6 months, supporting her to do some breastfeeding is a big accomplishment for her and the baby. Any and all breast milk that a baby consumes is beneficial.
For some, the decision to exclusively breastfeed is complicated. Patients may have previous negative experiences with breastfeeding. They may have different cultural influences or concerns about just the logistics of breastfeeding. It's one thing to say you're going to feed from the breast, but it's another to be the only person running the nighttime shift. It's obviously important to be respectful of the patient's perspective while still fulfilling your duty to provide sound medical advice.
I usually try to start the breastfeeding conversation well before delivery. Evidence recommends commencing the conversation during the very first prenatal visits. I'll often ask, have you had a chance to discuss your feeding plans with one of us at the clinic? Then I'll turn the floor over to the patient and encourage them to share their understanding of breastfeeding and explore previous experiences.
Once you know where your patient is coming from, it's time for the breastfeeding pitch. Tailor this to the patient and don't overwhelm them with all the details. Let's go over some of the many reasons we recommend exclusive breastfeeding until 6 months.
Firstly, all of the governing bodies recommend it. Organizations like the WHO and CPS recommend exclusive breastfeeding for 6 months. The main reason for this is the health benefits for both parties.
Here are the breastfeeding benefits for babies. Babies who are breastfed have less infections, including otitis media, as well as GI and respiratory infections. They are less likely to develop chronic diseases like asthma, eczema, diabetes, and cardiovascular disease. They are less likely to get childhood leukemia and have better cognitive development than formula-fed babies. Finally, the incidence of SIDS, or sudden infant death syndrome, is lower in breastfed babies.
There are additional benefits of breast milk for premature babies as well, including decreasing the risk of necrotizing enterocolitis. So encouraging the mom to breastfeed or pump and provide that milk to the premature infant can be beneficial even if the mom doesn't plan on breastfeeding long term.
Mom's health also benefits from breastfeeding. It's associated with lower rates of breast and ovarian cancer and also reduces the chance of developing postpartum depression and type 2 diabetes. Making breast milk burns a lot of calories and can assist with healthy postpartum weight loss as well.
But also, there are a lot of practical reasons to exclusively breastfeed, which might be worth mentioning in your pitch.
Firstly, money. Breast milk is free and formula is expensive. Depending on the type of formula, a baby's dietary needs, and accessibility, it can cost in the realm of $200 to $500 a month.
In this economy? Secondly, convenience. There's a lot of faffery involved in measuring and mixing formula, getting it warm to the right temperature, and sterilizing bottles after use.
Another concern patients sometimes have is feeling tied down with breastfeeding. But consider that once breastfeeding is established, moms can pump and freeze breast milk for another family member to give. Partners can be helpful in taking the baby following a feed to give the mother a rest. And if a mom wants to go out and visit friends, all they need is their baby, their breasts, and some diapers. No need to pack along all the formula mixing gear or figure out what you're going to do and where you're going to warm up those bottles.
What I often tell moms is that breastfeeding is honestly a lot of work up front. You've got to develop your milk supply, you have to figure out latch with baby, and all of that stuff. And you're doing all of that in the really early days of postpartum, which are kind of a wild ride just at baseline. So short term, it feels like a lot more work than giving a bottle. Honestly, it really does. But once you've got the hang of it, long-term breastfeeding is usually more convenient and less fussy. You always have it on you, it's always at the right temperature, there's no bottle cleanup required, and you end up saving a lot of money.
So overall, there are a lot of good reasons to breastfeed, most importantly for baby's health and mom's health, but also for finances and logistics.
It's always a balance of being confident and positive in counseling breastfeeding without getting too pushy and paternalistic. Just try to state the facts, give the pitch, and support women with whatever they choose.
The good news is that breastfeeding is on the rise. In the 60s, less than a quarter of mothers initiated breastfeeding at birth. And now 90% of Canadian mothers do. It's a huge change. But at 6 months, this really starts to drop off, and we end up having only 14 to 26% of moms exclusively breastfeeding. So what's happening?
The two most common reasons women stop breastfeeding are concerns about low milk production or difficulty with breastfeeding technique. Sounds like most women are hearing the pitch and want to try breastfeeding, but then encounter obstacles along the way. So let's move on to tackling those problems. Lesson number 2, good glands and high demands.
Oh my gosh, I love the title.
The titles are so good.
Always so witty.
I actually came up with that one. Okay, the formula for great breast milk production can be summed up rather simply. Milk production needs good glands and high demands. This is a theme we'll be returning to throughout the podcast.
Okay, so let's start off with the good glands piece. Hormonal changes during pregnancy cause amazing changes to breast tissue. Women will often notice that their breasts become fuller throughout pregnancy as a result. After delivery of the placenta, progesterone levels drop, allowing the second stage of breast lactogenesis. This is further duct development and now the actual production of milk. The final hormone piece is oxytocin, triggered by nipple stimulation, which causes release of the milk from the breasts.
As you can appreciate, the first part of our good glands and high demands piece is all about anatomy and hormonal influence. You've got to have milk ducts and sufficient glandular tissue development during puberty and pregnancy if you're going to produce breast milk.
We'll come back to good glands later, but we want to focus on the second part of the equation a little bit. That's the high demands. This is also super important for the milk production problem.
Okay, so depending on how you look at it, breasts are either super clever or really dumb. For the most part, they are going to work exactly as hard as they are asked to work. No more, no less. They adapt to upregulate and downregulate milk supply to match an infant's needs. Usually the more that is asked of them, the more they produce.
Herein lies the use it or lose it maxim of breastfeeding. Mothers need to ask a lot of their breasts to establish a good milk supply. This means moving milk out of them every few hours. This can be done by directly breastfeeding the infant or expressing milk using hands or a pump. And once milk production comes in, moms need to keep a constant demand to get a constant supply. And this means waking up all night long to feed or express. It means not taking days off. It means if someone else is getting up at night to feed baby a bottle of breast milk or formula, Mom also needs to be up at night to pump, because once breast supply decreases, it can be hard to get it back.
Some women have lots of milk, and they can be a little looser and faster with these rules about regularly stimulating their breasts. But for women with a more tenuous supply or who are working hard to increase their supply, having a consistent demand is super important, and we'll come back to this later.
For now, remember, the key to good milk production is twofold: good glands and high demands.
Okay, lesson number 3, the golden hour. So let's start talking about getting those high demands up and running early by introducing the concept of the golden hour.
The golden hour is the idea that the period of time immediately after birth is super important to establish great breastfeeding. We're calling it the golden hour because it sounds good, but honestly, it's the first 2 hours of life. Golden 2 hours just doesn't really sound as good.
Most of us have been trained to support this as part of routine practice. After delivery, place the baby immediately skin to skin with the mother. This is important for bonding, transitioning, and for developing milk supply. As a bonus, it also helps manage PPH.
If you can, try to leave the baby skin to skin for the first 2 hours. I always try and step out and do all my paperwork and delivery dictations in this time before coming back to do my initial newborn exam. This way, I'm giving baby as much skin-to-skin time as possible before whisking them off to the warmer for a once-over physical. Also, you can sometimes just do a physical on mom's chest, and you can get most of the information you need there too, in a healthy, well baby.
Ideally, in that first golden hour, I want to start making demands of the breasts. This means encouraging baby to latch and stimulating breasts.
Time out. Are you totally scared by the thought of coaching a latch? Maybe, like me, you've never breastfed a baby and you feel like a total imposter telling someone else how to breastfeed a baby. If so, you need to check out my absolute favorite website for breastfeeding called firstdroplets.com. I love sending first-time moms to this website a few weeks before they plan on delivering, so they're super pumped and feel really confident to try breastfeeding. I also love sending learners there even more. It's super user-friendly with really groovy graphics. It's not overly medical or technical. There's really good videos about breastfeeding and latching. They've got real babies, real boobs, and real good information. Far more than you can learn in people in a podcast talking about latching. Your homework is just to go to that website.
I haven't heard of this website, so I'm definitely going to check it out after we've done recording. And you should too, after you finish listening. After you watch the 12-minute video, you're going to feel way more confident in your ability to coach latching technique.
So, digressions aside, ideally in the golden hour, we've got a baby latched and stimulating the breast. But lots of babies are too sleepy after deliveries, lots of moms are pretty sleepy after deliveries, and sometimes they just need to chill out for the next 3 hours. Other babies aren't such great learners and don't master the latch right away. But we still want to stimulate the breasts to encourage milk production.
Encourage mom to be comfortable stimulating milk production in the first few days without having to rely on their babies to do it. This means using hand expression, usually. The First Droplets website has excellent videos on how to do hand expression. Ideally, you want to help your mom hand express within the first hour of life and encourage her to keep doing so every 2 to 3 hours.
Especially at night. And this is the really tricky piece to encourage people to do, but you need to be getting up at least 2 times a night in those first little while of establishing breastfeeding. So many moms are diligent with expressing every 2 to 3 hours except during the night because seriously, everyone wants to sleep, but it's really essential to stimulate the breasts continuously throughout those 24 hours.
Lesson number 3. Doctor, is this normal? As we discussed earlier, 90% of Canadian women will initiate breastfeeding, but less than a quarter of those will be exclusively breastfeeding by 6 months. The majority of these moms begin supplementing with formula out of fear that baby isn't getting enough breast milk.
One of the dreaded questions for a new resident is a mom asking, am I making enough breast milk? Or is this, insert various breastfeeding thing, normal? If you've never breastfed a child, these can be extremely intimidating questions. We're here to try and help you out.
First off, big picture stuff. If you can teach moms one thing to alleviate their fears, teach them this. A well-fed baby is one that's gaining weight and making a mess. It really doesn't matter what else is going on. If that baby is gaining weight appropriately and making enough diapers, that is a well-fed baby. That mom is crushing it, she's making enough milk, and her baby is doing well.
But of course, as diligent physicians, you're going to want to know more as well. So let's get some more details. First of all, what's normal for breasts?
In about the first 3 days of life, breast will produce colostrum, a thick, yellow, creamy milk that is rich in immunoglobulins and proteins. Assure women not to be worried that there isn't a huge volume. I call this stuff liquid gold. It's helpful to compare colostrum to babe's first immunization. The focus on those first 3 days of life is providing immune support, not giving baby volume. They got well stocked by the placenta before they came out.
In the first few days, while that liquid gold colostrum is being secreted, it's important to keep stimulating the breast at least every 2 to 3 hours to help develop the incoming milk supply.
From about 3 days to 2 weeks, milk supply begins to come in. Mums will feel breast fullness before feeds and a sense of emptying or decreased volume of their breasts afterwards. Their breast milk is also going to be higher in calories now. I think it's really important to tell people how long this phase can actually take. 2 weeks waiting for a milk supply to come in can be really frustrating and scary for mom and can make for a bit of a cranky baby. So being very supportive during this period, especially if mom is on the little bit longer side of the spectrum, is super important.
After 2 weeks, breasts are producing mature milk. At the beginning of the feed, foremilk comes first. It's a slightly blue-tinged colored, more dilute milk that is great for hydration. Then at the end of the feed, the breasts release hind milk, which is fattier and rich in calories.
Now let's talk about babies. What is normal for a baby in the first day of life?
Usually, babies will feed within 1 to 2 hours of birth. Then they take a big snooze. They were just delivered after all and are usually pretty tuckered out.
After their big snooze, for the first 24 hours, babies often cluster feed. That means periods of back-to-back feeding for a few hours, followed by a longer period without. This means breastfeeding in the first days is sporadic and unpredictable.
After about 3 days, babies maybe start to settle into a more established routine. Of course, no baby is going to follow the textbook perfectly, but if one did, what would textbook feeding look like?
Were a tiny baby to read a textbook, they would feed at least 8 to 12 times in a 24-hour period and often more. This means about every 3 hours or less. 2 to 3 of those feeds being in the middle of the night. They'll spend 20 to 50 minutes total during a feed using both breasts at that time. After feeds, they're sleepy, tired, and content.
Okay, let's just back up and talk about the length for one more moment. These numbers of 20 to 50 minutes using both breasts are intended to give you a framework as a physician, but quoting this to the book can be harmful. It can lead mothers to feel like their breastfeeding journey is not progressing appropriately and that they don't have enough milk.
The length of a feed and whether a baby feeds at both breasts depends on the breast capacity. A breast with more dense glandular tissue can store more milk, and therefore that baby will eat less frequently and just from one breast per feed, perhaps, compared to a baby whose mother has a lower storage capacity. A breast with less glandular tissue will see a baby eat more frequently and often from both breasts. The size of breast does not reliably determine storage capacity.
It's far more important to focus on the quality and number of feeds in a day. Way more important than the length of feeds or how many breasts are used. It's all very baby dependent.
So I think the really big thing to remind moms or talk to them about when you're talking about the length of the feeding is paying attention to baby's cues and looking for nutritive feeding. So you're looking for that suck and swallow. Oftentimes babies can get tired at the breast and might just be hanging out, getting some snuggles, some cuddles, getting familiar with the breast, but they're not actually feeding. And so having a baby who's just cuddling at the breast for 50 minutes doesn't necessarily equate to a good feed. So really coaching moms on what those cues are can be helpful to, again, ascertain the quality of the feed and not just going based on length of feeding time.
Nice, thank you.
Babes really do fall asleep at the breast like there's no tomorrow. And honestly, you can spend a lot of time with just a cold washcloth, really bothering their little feet and tummies to keep them awake and focused on feeding to make those times really productive.
Babies will also go through growth spurts at 3 weeks, 6 weeks, and 3 months. They may start cluster feeding again at these times. Mom will worry something is wrong and their supply is running out, but really, this is normal. Baby is triggering the breast to increase their production and, again, often at night. I don't know, late nighters. When babies are cluster feeding, tell mom to give it a day or two. Likely the breast will increase their production and the baby will settle back into a more regular pattern.
But truthfully, anxious perfectionist moms can get hung up if their baby is not acting like a textbook. Remember, what really matters is the big picture.
A baby's only 2 jobs are to gain weight and make a mess. If they gain weight appropriately and make enough diapers, that's a well-fed baby.
If they are doing this, it doesn't matter if mom is cluster feeding, feeding every 2 hours, feeding one breast at a time, feeding while doing handstands. This is a well-fed baby. Reassure her that she is killing it with her breastfeeding.
But if you listen to our pelvic floor physiotherapy lecture, she probably shouldn't be doing handstands. So let's talk normal weight gain. This is hard to remember, but I've made a sweet infographic for you to download and stick on your phone. Please check out in the show notes.
I'm going to go put that in my Evernote right now. It's expected that babies will lose weight in the first few days of life. If they lose more than 10% of their birth weight, that's too much and it's time to call peds.
If they are down 8 to 10%, that's a gray zone. Use your clinical judgment. If that kid is not looking well, you may want help. But if the kid seems well overall, you can just watch these babies very, very closely. You don't necessarily need to swoop in with bottle feeds, but you need to be paying really close attention and watching for that turnaround.
Between day 5 to 14, babies will start to turn the corner and start putting back on weight, usually about 25 to 35 grams per day.
By 14 days or about 2 weeks, they should have made it back to their birth weight and many will have surpassed it. From 2 weeks to 2 months, they'll keep gaining 25 to 35 grams per day.
After 2 months, switch to using a growth chart to track that weight gain.
As far as outputs are concerned, there are lots of charts and ranges to keep in mind. I like a handout from Prenatal Services BC, which shows what is normal for poops and pees based on days of life. In my most simple terms, when I don't have one of those to reference, I usually tell parents at the very bare minimum, at least 1 wet diaper per day of life until 1 week. So at least 1 wet diaper on day 1, 2 on day 2, 3 on day 3, etc. By 1 week, we should definitely be having at least 7 wet diapers per day, probably more.
Okay, so let's review. The question of, is my breast milk enough, is going to come up time and time again on well baby checks. All family docs need to be skilled in assessing this. Being able to reassure someone that they're doing a great job is really important. A parent who's confident that their baby is healthy and their breastfeeding is normal is not going to be reaching for the bottle of formula.
And I think it's so important to provide that encouragement because there's so much judgment and there's lots of social media and there's lots of different things people will hear about how to do it the perfect way. So I think reassuring them with their weights and things like that. And then on the flip side, if there is a problem with breastfeeding, early identification is also important. That means corrective measures can then be taken to keep babies healthy and to establish or increase breast milk supply. Either you're doing this or you're sending these moms early to someone with more experience in breastfeeding.
Okay, so let's practice assessing this. If you're listening to the podcast after I give a case, you can hit pause and think about it yourself and maybe do the math yourself, or you can just listen to Caitlin and Kyla try and figure this out.
Oh, seriously, it's spontaneous.
Oh yeah, it's live. Have you learned things today?
Okay.
Imagine you are seeing a mom and baby at the 1 week postpartum checkup. This is a very common experience for family doctors. This was a term routine delivery. Nothing went wrong. But she is worried she does not have enough breast milk. Yesterday, she gave her baby some formula because she was worried they weren't giving enough. They just look hungry. She's been reading mama blogs and she wants to know if you'll prescribe her domperidone. What do you feel about hearing this story and what else would you want to know?
I think weighing the baby would be helpful.
Yeah. Okay, baby weight's good.
I want to know more about what her breastfeeding has looked like. We're a week in. How often is she feeding? How long is it lasting for? Is it happening overnight? And also, like, what are her ins and outs looking like? Is she getting enough water? Is she getting snacks? She needs to be eating basically every time baby is eating.
Yeah. And I want to know why she's worried she's not making enough. Like, is she never felt engorged? Is she feeling that the breasts are always empty? Is she thinking that baby is really fussy or showing too many cues for feeding all the time? Or are they just crying? What is her perception of not enough? And what cues is she taking to think that?
Spot on, guys. It sounds like we need to actually weigh this baby to see maybe they are gaining weight perfectly. Take a good history to see actually maybe what she's doing is totally normal, and maybe this baby is fine. So she says she doesn't know exactly how often she's feeding. She goes based on her baby's cues, but she reckons about every 2 to 3 hours. She feeds her baby for 20 to 30 minutes using both breasts. He is content and sleepy after feeds. He made 8 wet diapers yesterday. You weigh him in office and he is minus 5% of his birth weight at 7 days of life. She is shocked and concerned that he is underweight. What do you tell her?
This could be normal.
I think this comes up really often. Yeah. It's totally reasonable for him to be not back at his birth weight at 7 days. And you can hopefully we have maybe some other measurements and you can do a little bit of charting as to if he's come back from a more significant weight loss after birth. And then just lots of counseling around sort of what the parameters of regaining weight and then surpassing birth weight are and just normalizing.
Yeah. And arranging, doing maybe a couple of closer weight checks just to get that trend if you don't have the data beforehand of are we still going down or are we going up? Because I think that can be, like Caitlin said, nice to know for the mom to be able to see, oh yeah, it's okay. We're going in the right direction.
And I think one really important thing about baby weights is to try and avoid having mama weigh baby at home, unless it's an accessibility question. And then absolutely whatever we need to do is fantastic. Meet moms where they're at. Asking them to leave the house multiple times in the first week of life is a lot. But it can be something that parents really focus on, especially if weight gain is a little bit slow and can be counterproductive in the long run. So just trying to keep the weighing at a nice, relaxed way.
And depending on where they are, public health nursing might be able to go in and do a weight to avoid that mom feeling she has to do it and also not having to leave the house, depending on what the services are.
Yay, public health.
Awesome, guys. You got this. My goal with this case was to illustrate a concerned mom who actually has a baby who's totally who's weighing as expected, and she's feeding in a totally quote unquote normal way. So this is a mom that needs a lot of reassurance and a lot of pep talking that she's actually doing great. No, she doesn't need to supplement her baby, and her milk supply is coming along well because that baby is gaining weight and making wet diapers. It's doing its job. Okay, so how about another case? This one's harder. A term baby following a normal delivery, and again, you're seeing them for their 1 week postpartum check. Mom is concerned about her breast milk supply. The baby has been feeding every 3 to 5 hours for 40 minutes total, but seems sleepy after 10 and doesn't seem to do a lot, just mostly hanging out. Furthermore, breastfeeding is uncomfortable for mother. The latch is quite painful. Her babe had only 3 wet diapers yesterday. His weight is minus 8% from birth weight, and it's day 7 of life. What do you think about this kiddo? Let's start with weight and output. Are you happy? Are you not happy?
I'm more worried about this little one
And
this mama.
Yeah, the 3 wet diapers are definitely not making me super happy. The minus 8% from birth weight a week in, I'd really love to know where he was sort of when they left the hospital or if they had a birth at home, when the birth attendants left, what he was at. But overall, more spidey senses for sure.
Yeah. And wanting to know as well if they had jaundice or anything like that. Like, was there any concerns why baby could be more sleepy? What's been going on? Any infection signs?
Yeah, like 8% is that gray zone. So it's not like we have to, press the panic button, call peds, but we need to pay more attention here. What do you think about the feeding pattern?
I feel like every 3 to 5 hours is it's not quite frequently enough. I mean, to be honest, this was my baby. She had some jaundice and we were both very tired in that first week postpartum, and she was probably feeding Q 3 to 5 hours for 40 minutes and super sleepy. And it really took some dedicated lactation consultants to get the latch a little bit more comfortable so that everybody was doing a better job, explore some different holds that we could use to make breastfeeding more ergonomic and make it more comfortable for me. And then just setting a timer on my phone, which was the last thing I wanted to do in the first week postpartum, but feeding every 2 hours, using both breasts and just really working on getting that volume going and establishing a bit more of a routine around it. And then lots of pinching my baby, which is not something you really expect you're going to do in the first week, but cold washcloths, tickling feet, poking little tummies, anything to keep them kind of as alert and oriented as you can when they're on the breast to make really good use of that time.
Yeah, kind of back to that nutritive sucking and encouraging them to make sure that they're active, looking for those swallows, that kind of thing. And I think one thing to also tell moms is, again, because people might get information from all over the place and they might have a friend whose baby's sleeping through the night, they might think that that's normal at a period in baby's development that is not actually normal or what we expect. So brand new babies shouldn't be sleeping through the night. They should be waking up for feeds. And if they aren't, we should be encouraging them to wake up for feeds. Once you're getting into an older baby, several months of age, that can be normal and acceptable. But early on, those babies need to be feeding more often. And I think we just have to be mindful that the baby changes so much day to day, week to week, month to month, that the advice we're giving and that mom might be following from whatever resource is appropriate to the age that their baby is at that time.
Spot on, guys. My next question was going to be, what might you recommend? But you guys have already given me excellent recommendations. So overall, this is a case of a baby who is not gaining weight as great as we'd expect. And so things we could do to try and optimize that and get more milk to baby is review the latch and make sure the latch is actually effective, which is probably not because it's painful for mom. Really focus on feeding every 2 to 3 hours through the night. And some other things which we could explore would be things that enhance milk supply, like pumping following feeding and topping baby up with express breast milk would be another option here.
I think it would be important as well to make sure we think about the baby when we've got this larger weight loss. If we do need to encourage supplementation for baby to make sure that they're gaining appropriately, to tell mom, like, this is not necessarily a permanent solution or a permanent change, but right now for the health of your baby, we might need to do a little bit of supplementation. And if that happens to be with formula, if the milk is not enough yet, that's okay. And it's not necessarily a bad thing. And then doing that pumping when you're giving some formula to give that breast stimulation, or sometimes doing like an SNS or like at the nipple supplementation so that they're still getting the breast stimulation, but baby's getting calories. And it might be a short-term thing, but just we're kind of balancing building that breastfeeding relationship and making sure baby doesn't continue to plummet. So I think we need to just be mindful of that too.
And it would be totally okay if you were not super confident with breastfeeding for just to say, ooh, this is a gray area, baby, I need help, and getting a lactation consultant involved if you're not feeling that confident about breastfeeding yourself. I hope everyone can confidently counsel the first mom. If this one seems a little tougher for you, that's okay. That's what you got help for. Any thoughts, Caitlin, before I move on to the last case?
I would say if you have access to lactation consultants in your community, particularly lactation consultants who will visit new parents at home, it can be really helpful to just go through the ergonomics and the setup of a new parent in their house. What kind of pillows do they have? What kind of a chair are they using? Are there things that can be done with the space as a whole that will really support getting that latch?
Awesome. Okay, one last quick snapper of a case. We've now got a 6-week visit. Mom has brought her child in and she's worried her breasts are drying up because for the last 2 days, her baby is just insatiable. Lots of cluster feeding, especially at night. Baby's weight is on track and the child looks well. What would you tell this mom?
Can I get a growth spurt?
Boop, boop, boop. Yeah, classic 6-week growth spurt. Just tell her to hang on for another 2 days and likely her breast milk production will increase and baby's going to settle into a more normal pattern again. Okay, lesson number 4, increasing milk supply. So we've talked about what's normal for breast milk and what is normal feeding patterns for babies. But what happens when we identify that a mother truly does have low milk production? How can you investigate and increase supply?
Firstly, you need to go back to the master equation. Milk production needs good glands and high demands. We're going to start with the high demands because this is the more common problem.
Remember how we talked about breasts being either really clever or really dumb, and that they only make the amount of milk they're asked to? If a mom has low milk supply, we need to ask more of her breasts to get more output. There are a couple tricks to try here and consider some of the non-pharmacologic ones.
Firstly, eat a well-balanced diet and stay well hydrated. You don't have to go overboard though, just drinking enough that you're not thirsty. Moms don't need to chug tons of water.
Secondly, observe a breastfeeding session and ensure baby's latch is good. This should mean the baby can adequately remove milk from the breast.
Be more diligent about stimulating the breasts every 2 to 3 hours. So unfortunately, that means taking breaks at night and having the other parent give a bottle isn't going to be a great thing to do in this situation.
The breastfeeding clinic I was at just recently, the way she always said it was, you have to replace the feed that someone else is doing. So if someone else is giving that formula, you need to be doing a pump.
If for some reason the mother's away from baby, like if she's at work or she's out seeing friends, she needs to be pumping every 2 to 3 hours. Every time baby eats, she needs to remove milk from her breasts.
After feeding baby at the breast, mom can pump for 10 minutes on each side to signal the breast to make a little bit more milk.
Or while feeding on one side, she can use a device like a Hacka to stimulate the other breast and catch milk on the other side.
If you try these things and still aren't getting the milk production that baby needs, you can consider trying a galactagogue. This is a substance that increases milk supply.
For parents who prefer a more natural approach, there are many different herbs that may have benefits for breastfeeding and breast milk supply. The evidence is mixed, but many mothers may want to try this. This includes things like fenugreek and blessed thistle. The Academy of Breastfeeding Medicine has a protocol for galactagogues, including natural ones, with tons of good information, and we will link to it in the show notes.
Yeah, they're a great resource for all kinds of things with respect to breastfeeding, so 100% recommend checking out their website. Let's focus a little bit more on medications you can prescribe to help with milk production. Domperidone is a prescription medication that is used off-label to increase milk supply. It needs to be slowly titrated up and slowly weaned off. It is a good medication, but be wary of prescribing at higher doses. Health Canada is currently investigating its use, as some women report severe mental health side effects, more likely at higher dose ranges and when not weaned appropriately.
Finally, look out for things that can decrease milk supply. Avoid allergy medications as well as cold and sinus medications, as well as some hormone-containing birth controls, especially estrogen-containing birth controls, as these can interfere with milk production. Watch out for peppermint, parsley, and sage as well. Some women are drinking peppermint tea for comfort and inadvertently decreasing their milk supply if they're very sensitive to it. At our clinic, we sometimes use peppermint tea as a natural way to decrease supply for moms who have too much milk and who are planning on stopping lactating.
If, despite avoiding triggers and using pharmacological and non-pharmacological methods, mom supply doesn't increase, it's time to consider the glands. It may be possible that she just has insufficient glandular tissue, and no matter how much is asked of those breasts, they just aren't going to be able to produce.
So what are the signs of poor gland development? When asked, women may say that they didn't notice much change in their breast during pregnancy or during puberty, and on examination, their breasts may be small with a concave appearance or wide-spaced nipples.
Women with previous breast surgery are at risk of not having as much glandular tissue to begin with. Also, surgery can damage small nerves needed for the milk ejection reflex. For others, hormonal interference may be a culprit. Untreated thyroid disease, PCOS, retained placenta, or large postpartum hemorrhage can all cause hormonal or physiologic imbalances that affect milk secretion.
It's important to know that people with less glandular tissue may still be able to successfully breastfeed. It can be impressive how much milk can be produced by seemingly small breasts, but certainly keep a close eye on these folks. They may not respond to measures intended to increase supply. For a small subgroup of moms, their breast tissue just won't be sufficient to exclusively breastfeed no matter how hard they try.
Regardless of how much milk a woman is able to make during their breastfeeding journey, just be supportive and remind them that even partial breastfeeding will have health and attachment benefits, both for them and for their baby.
I honestly think one of the most helpful things sometimes a physician can do for a mom who's really worked hard to increase her supply and not being successful is just to recognize that and commend her on her hard work and let her know it's okay to not exclusively breastfeed, because for some women's journey, it's just not a possibility no matter how hard they try, and just recognizing the effort they put in and that the breast milk they are giving to their baby is awesome.
Yeah, it's super important.
Lesson number 5, the bother with bottles. Okay, with the last bit of time here, let's talk about bottles and pumps. Something you were totally taught all about in med school, right? Right?
Oh my.
Okay, let's start with bottles. Bottles are going to come up because they are totally practical. Parents may want to primarily breastfeed, but have the option to use a bottle some of the time, like when mom is off doing something else, like going back to work or med school. Or some families enjoy that other people, like dads, can be involved in the feeding experience by giving a bottle on occasion. Sometimes, if there are concerns about a child's weight, we'll recommend topping up breastfeeding with bottle feeds. And finally, some parents will choose to only bottle feed their baby for a variety of reasons.
The first decision a parent needs to make is what to put in the bottle. This could either be formula or express breast milk. Breast milk can be expressed and stored at room temperature for 4 hours, in the fridge for 4 days, and in the freezer for 6 months.
The next decision is how to give the bottle. One option is with maximum transferring efficiency. The other option is to do a slower, more involved paced bottle feed. Ultimately, this is up to their parents and what works for their lives, but we'd recommend paste bottle feeding for a few reasons.
In paste bottle feeding, the parents are trying to stimulate a more natural eating experience for the baby, like what occurs at the breast itself. With paste bottle feedings, babies need to work to get the milk they want and get to choose when they're feeling full and done with the feed.
To set up paste bottle feeding, parents choose a bottle with a physiologic nipple, one with a wider base and a shorter nipple. They use a low flow nipple like a newborn size or size 1. Then they hold the baby in a comfortable position where they could refuse the bottle if they wanted, usually sitting or semi-recumbent.
Then the bottle is offered to the baby. They are allowed to play with the nipple and choose to start feeding. The bottle should be held horizontal to the floor rather than directly upright, so that the baby has to suck and draw in milk rather than getting an easy ride with the help of gravity. I've actually heard of people putting one of those carpentry levels, like taping it to the side of the bottle, to help to stay mindful to keep it horizontal in the middle of the night.
When baby has a natural pause, the bottle should be withdrawn and then offered again. If baby refuses a few times in a row, that's the end of the feed. If this is done properly, it means that a paste bottle feed could take at least 20 minutes, similar to a breastfeed.
Because the baby has to work for the meal, it decreases the chance that they will develop a preference for the bottle and reject the breast. Because, hey, babies are smart. They're going to take what's easier to... Same as we all do.
If a mother wants to do a combination of breast and bottle feeding, paste bottle feeding can be important. It will minimize the chance that baby develops a preference for the bottle and rejects her breast. It's important to remember that if baby is having a bottle, the mother's breast is not being stimulated. So for the most part, anytime baby is having a bottle, the mother should be expressing breast milk, like pumping while at work, for example.
But even if parents are exclusively bottle feeding, it can still be beneficial to try paste feeding. This is because it follows baby's cues, allowing babies to not be overfed. It might be helpful for establishing healthy eating habits with food, where a child learns to listen to their own hunger cues rather than just eating everything that's offered to them. And feeding is basically the only workout a baby gets all day, so we should probably give it to them.
Paste bottle feeding can result in less reflux and irritability, as the meal is consumed at a slower pace and the child is deciding how much food they need in a sitting.
These longer feeds provide important parent bonding time, which is so important for healthy child development. Teaching moms who can't breastfeed for whatever reason how to pace their bottle feeds may feel like a real win for them. Lesson 6, pump it up. Okay, final topic, breast pumps. Again, something you totally had a great lecture on in medical school or residency, right? Right?
Really, the best way to learn about breast pumps is to look at one in real life. They're kind of strange-looking contraptions, but they're really very logical once you sort it out. So if you have any breastfeeding friends or family members, see if they'll take you on an educational tour of their pump.
But we will try to impart some sweet oral knowledge in the meantime to try and help you out. There are a few important parts of a pump to know about. First is the flange, which looks kind of like a funnel and sits on the breast. Next is the engine, which creates the suction. Then there is the movable membrane, which transmits the suction to the breast. Finally is a reservoir to catch the milk. Super simple, right?
Good pumps have 2 settings. The first is a non-nutritive suckling phase, which stimulates letdown. When that occurs, the user can then switch the pump into an expression phase, which provides longer and deeper suction. This phase is used until the breasts are empty and no more spray is occurring. If the higher power settings are used, the breast will be emptied quicker, but used with caution and so as not to cause trauma. And truthfully, I don't know if you really need to empty the breasts all the way. You may need to just express until the breasts feel like they've let out a decent amount of milk. Sometimes people can overpump themselves into an oversupply.
Yeah, that's really important to tell people.
It's important to know that the physiology of letdown and expression requires the body to be relaxed and ready to actually do this. Some people will need privacy in a calm, quiet, stress-free environment to allow them to effectively let down and start pumping. Your super stressed, career-focused woman may need to step away from her computer and coworkers to relax enough to pump. Looking at cute pictures of a baby can be also very helpful for starting that letdown.
Now, super important, pumping should not be painful, even on high power settings. If it is painful, the first place to look is at the flange. Usually pumps will come with an arbitrary size flange, usually size 24, but not all breasts are the same. So a mother may need to change hers out, but probably no one's ever told her that. Flanges are like funnels. with the cone part of the breast and the nipple extending into the tube part at the bottom. A flange should be large enough that the nipple can sit inside the tube without touching the walls. However, it should not be so big that the breast or areola tissue gets pulled into the tube when the pump is working. This will cause pain and trauma. Flange sizes can also change with time as the breasts change, and some people might even need a different flange for each breast.
There's also companies that sell flanges that are soft and rubbery, and it is worthwhile figuring out a flange that really works for you.
Some women like to use a little oil between the part where the cone of the flange contacts their breasts. This is okay, but be aware of contact dermatitis and clogged pores. So, what pump should women choose?
We're not sponsored by any of these pump brands, and, well, I do have preferences, but as a podcast team, we are preference free. We'll try to give you some general advice here.
First things first is pumps can be expensive, so it's often worth renting or borrowing one first so a woman can know if this is one that's going to work for her before committing the cash for her own.
Many hospitals and pharmacies will rent out pumps to women, and this is a good way to try one. There are two general types of pumps to consider: plug-in, unwieldy electrical ones, or portable battery-powered pumps.
Plug-in pumps are really simple and usually work great. They're usually more affordable too, starting around $150. They can be a bit clunky because they need to be plugged in. They also may not be easily portable when you're doing errands or over at a friend's house or going to and from work. Some insurance providers will provide coverage for these with a prescription.
For moms who can afford it, there are some fancy portable hands-free options. Some brands are so slick and portable that you can wear them underneath your clothes and pump while scrubbed in the operating room. I've seen several surgeons doing that. These are about $400 and there are fewer options in Canada.
Caitlin, we do want to know, what are your preferences? Tell us about pumps. Tell us what's good.
So I had a Medela battery-powered pump, and I went back to medical school for my clinical clerkship when my baby was 3.5 months old. So I pumped 4 times a day through clerkship for a heckin' long time. And honestly, it was a really great pump. I used a couple of other brands, which I honestly, in the fog of postpartum, can't remember the brand names of at this point. But a lot of my friends used the Medela and really loved it. One of the most practical tips that I can come up with is to have a full other set of parts. Having a full other set of parts, and I mean flanges, I mean the little membrane that goes inside the part that attaches to the flange, and then the part that attaches to the flange itself, a full other set so that you can wash that in the dishwasher or by hand when you get home from your day and have another set ready to go so you don't have to worry about it in the morning. Other hot tip is put them in the fridge. Your baby's milk is good in the fridge the whole day while you're at work, so all of your pump parts are totally safe in there too. And that saves you from fussing about how to clean them appropriately between each of your pumping sessions while you're at work.
Thanks, Mama Caitlin.
Awesome. Other tips to consider: it can be handy to stash a manual hand pump in the car for when a mom forgets something or when some part of her pump breaks down. There's nothing worse than being out and about with breasts full of milk and no way to drain them. Another option in this situation, of course, is just to hand express for comfort, but some women will like to have a pump option, a hand pump option.
But teaching them how to hand express is nice because most people aren't going to be without their hands.
It's a good skill.
They usually come together.
Yeah.
Hands and breasts. Sometimes pumps are used in order to increase milk supply to help make more demands of those glands. So how can this be done?
You may have heard about triple feeding. This is where mom will feed at the breast, pump, and then feed baby the expressed breast milk. This is definitely a thing. Capital A, capital T. Can definitely help increase supply. But just realize that it is exhausting and can basically take up an entire day while you're trying to triple feed every 2 to 3 hours. It's not realistic that she'll be doing this at every feed.
It's also worth saying there's not much point pumping for long periods of time at the breast with no milk coming out. If this is happening, tell the mom to take a break and try again in another 20 minutes. Increasing the frequency of pumping will be way more helpful than spending 30 minutes at the breast expressing nothing but air. Studies have demonstrated that mothers will obtain the most breast milk within 10 to 15 minutes, so we recommend spending less time per pumping session and rather increase the total number of pumping sessions throughout the day.
I think that's less risk of trauma as well by having shorter pump times.
Some parents may also find it helpful to warm up the breast a little bit before pumping. You can just throw a warm washcloth or a little bit of a hot water bottle on the breast, and it just kind of makes things work a little bit better. Folks are struggling getting that pump set up.
And if they don't have that like suckling setting on their pump, or they find that they have to pump a long time before they get let down, they could try hand expression and tactile stimulation before starting the pump, so that they're still shortening the amount of time they're pumping, but they're getting the bang for their buck essentially while they pump.
Fantastic. Any last thoughts about pearls and tips about pumping or bottles from you two that you've seen in your days?
I think if you're going to have pumping as a big part of your life, investing in a solid pump that you really feel is going to work for you is a must, as long as it's financially achievable. And also a breast pump that does both breasts at once is key if you're trying to deal with a day of parenting, but also being someone who's at work or at school. You need to be as efficient as possible. And then the other thing, I would just always encourage moms to take up space in that company fridge. Don't be shy about having your breast milk in the fridge. Just be like, this is where my pump parts live. This is where my breast milk lives. Like, you all can put your sandwiches on another shelf if it bothers you. This is my space.
Yeah. One really good tip I had recently when I was in the breastfeeding clinic as well was to remember that starting to pump to produce extra milk or anything is an intervention. And so if you're encouraging someone to do triple feeding, whether it's because baby needs supplementation because they're losing weight, or because you're trying to stimulate supply for a short period of time, to have an end game. You don't just say, go ahead and triple feed and not have an end plan. So making sure you're thinking about where this is going, so that either moms don't give up breastfeeding entirely because it's exhausting and impossible to do, and so that you have a frame to kind of reassess and see, is this working? And not setting parents up for feeling like they're failing or like getting breast trauma or anything like that.
Awesome, guys. Okay, with that, let's head into just the pearls for the episode. Take it away.
All right. Number 1, give a good pitch. Encourage exclusive breastfeeding for 6 months. This protects babies from infectious diseases, decreases the risk of chronic disease, improves cognition, and lowers the risk of SIDS. Breastfeeding protects mothers from cancer, diabetes, and helps with weight loss and postpartum depression. Breastfeeding is also more affordable and easier than bottle feeding once it is established.
Number 2, respect the golden hour. Coach a latch or hand expression within the first hour after delivery. Check out firstdroplets.com to learn how to do this.
3, what is enough breast milk? Enough for baby to gain weight and make a mess. If the baby is gaining appropriate weight and making the expected number of diapers, they are a well-fed baby.
4, the secret recipe for milk production is good glands and high demands. Most often, the problem is not enough demands. If there are problems with low supply, make sure mom is eating and drinking enough. Make sure latch is good so that you know baby is actually able to move the milk from the breasts in every feed. Finally, make sure mom is stimulating the breasts Q 2 to 3 hours by feeding, pumping, hand expressing, or whatever works, especially at night.
Number 5, if after doing all of the above to ensure high demands and she's still not getting good supply, consider the good glands piece and widen your net to the other physiological causes of low supply. This is also the time to consider galactalogs, either natural substances or domperidone.
6, consider coaching paced bottle feeding to help avoid bottle preference, to encourage healthy eating habits and parental bonding.
And 7, pumps are hard to learn about in a podcast, so get a breastfeeding friend to show you how it works, Google some pumps, look at the labels, or find a lactation consultant. Pumping should never be painful. If it is, consider that the flange is maybe not the right fit. Triple pumping is also a lot of work, so be realistic with your expectations.
Okay, thank you very much, ladies. Thanks again for our listeners for tuning in. We hope our episodes are helpful in triggering your memory or kickstarting some studying. We hope that you learned many things about breastfeeding today. As always, you can contact us with Twitter or Instagram or at the same CCFP podcast email, hello@thegeneralist.com. And if you're interested in helping out with either branch of the podcast, let us know. We are always excited to have new people on board. Thanks again for listening. And thanks to Kyla and Caitlin for answering surprise trivia during this podcast. You guys did great.
Thanks, Betty.